Hello, and welcome to my presentation on tardive dyskinesia, or TD. My name is Atlas. I am a NAMI peer facilitator with tardive dyskinesia. I'm going to go over exactly what TD is, how it is diagnosed, and how it is treated. I will then share my experience with tardive dyskinesia. To start, I'm going to go over exactly what TD is. Tardive dyskinesia is a drug-induced movement disorder. What that means is that people may develop tics or involuntary movements as side effects of the medications, like antipsychotics, that are used to treat disorders like schizophrenia and bipolar disorder. These movements could be anywhere from spasms in the hands and feet to lip smacking and tongue thrusting. The most common form is rapid eye blinking or eye twitches. Here is a short video example of what TD may look like. This video goes over various types of movements. The first example is finger or hand twitches. Remember that all the movements in this video are involuntary. The second example is the first type of facial tics, the tongue. You can see the tongue push out against the cheek as well as poke out of the mouth. The third example is one form of torso movement. Another form may be rocking back and forth. The next example is of toe tapping or feet tapping. My brother and I experienced this type of TD. The fifth sample shows the second type of facial tics, the jaw movements. This is categorized differently than the tongue and categorized separately from the next two samples. This next one is the last type of facial tic in the mouth, the lips. This is often lip puckering or smacking. The last one in the video is of the facial tics in the eyes. Not only is the excessive blinking a part of it, but you could see it in the eyebrow movements. TD is caused by long-term use of neuroleptic medication. These medications can be antipsychotics, major tranquilizers, some older antidepressants, and some GI medications. This is not a complete list of the medications due to the list being very long. The prescribing doctor of any medication should go over the risks. Tardive dyskinesia is usually followed by several months of medication use, but can happen after as few as 6 weeks. 30 to 60% of patients who receive long-term treatment with an antipsychotic may develop TD. The reason the range is so high is because some medications have a relatively low chance of developing tardive dyskinesia, while others have very high rates. Certain factors increase the risk, such as being elderly, being female, having diabetes, or having other mental illnesses. The first thing you should do if you suspect you or someone you know has TD is to tell your psychiatrist or primary care physician. The doctor should then perform an abnormal involuntary movement scale test. The series of tests might be asking you to turn your head or open your mouth, touch your thumb to each of your fingers, hold your arm straight out in front of you, or stick your tongue out. These tests would test your control over movements. Someone with a severe AIMS score would have a jaw that without the patient doing it. Someone with a severe AIMS score would have jaw that moves without the patient doing it, or they would tremble while holding their arms straight. Then the doctor would test the rigidity of the patient's joints. Then the doctor would test the rigidity of the patient's joints. They might turn the patient's head, bend the arm at the elbow, and extend the leg at the knee. A severe score would be if the joints are rigid. I will show you a video of some people being scored. I apologize that the video is outdated, but I will show you a video of some people being scored. I apologize that the video is outdated, but that just goes to show how the topic is not discussed enough and needs more awareness. TD affects people emotionally. TD affects people emotionally. 61% of people with TD reported feelings of anger, anxiety, frustration, and despair. This is represented in the pie chart on the left in blue, while 52% reported feelings of low self esteem, low self worth, and being a burden to loved one. This is represented in the pie chart on the right in the blue. There is also a social impact to TD. 62% of people with TD reported their relationships with others, participating in social events, and doing things in the public were affected by uncontrollable body movements from TD. After diagnosis is reached, the doctor and the patient should decide on the course of treatment. As a reminder, not everyone is going to react to the same way to a course of treatment. The good news is there are lots of options for treatment. The first option is to adjust or change the medication that is causing TD. Lowering the dose of the medication could stop the symptoms, but if that is not enough, stopping the medication and substituting it with less risky one is an option. If neither of those are viable, there are medication made specifically to stop TD. Some folks may prefer a more natural approach to tardive dyskinesia and may opt for homeopathic remedies such as melatonin, vitamin B6, vitamin E, or ginkgo, though these are not approved by the FDA. It is important to catch TD early because symptoms may become permanent if caught. It is important to catch TD early because symptoms may become permanent, but if caught, may be reversible. Here I will show you Jeff's story about living with schizophrenia and tardive dyskinesia.
My name is Jeff, and I'm from Philadelphia. I was diagnosed with schizophrenia when I was 17 years old. About a week after my 17th birthday, I had a nervous breakdown. I was hospitalized, and that was the first time I actually took psychiatric medicine. I was diagnosed with Tardive Dyskinesia in 1997. What were the symptoms that I have? A lot of people stare. When children stare at me in the bus, it shows that it's very noticeable. My grimacing. There's times difficult brushing my teeth, putting a belt on in the loops of my pants. Raising awareness for TD is not only important for family members and patients, but also the general public, so they have a better understanding and feel more comfortable when they experience someone with TD. I would suggest that people that think they have TD symptoms to consult with a provider. Despite my schizophrenia and tardive dyskinesia, I'm showing other people that not only can you have a normal life, you could have a wonderful life.
I would now like to share my experience with TD. My journey with schizophrenia started at 16, but my journey with medication started when I was 18. I was hospitalized due to my mental health, and the doctor immediately put me on an antipsychotics after hearing about my hallucinations. I didn't feel good on it, so my regular psychiatrists began cycling me through several medications over a short period of time. I tried several, and I had begun having spasms in my lips, twitches in my feet, and rocking during this time, though I could not tell you exactly when. During my time in an intensive outpatient program, the psychiatrist on staff there noticed my tics and administered the AIMS test. He found that my joints were moderately rigid, my tongue spasmed wildly, I rocked constantly, and my foot twitched. After diagnosing me with TD, he began prescribing After diagnosing me with TD, he prescribed a medication not listed. After diagnosing me with TD, After diagnosing me with TD, he prescribed me a medication not listed in the presentation. Immediately, though, I began to hallucinate more intensely in ways I have not before. After a week of no improvement in my tics, but a worsened mental state, he took me off the new anticonvulsant. He did not make any adjustments to my antipsychotic. After leaving the program, although I felt heard and seen in group therapy, my TD began to make me feel like a burden, and my self esteem went into a free fall. At a worsened mental state, feeling like there were no improvements made by the medication, I went off all my meds. In January of 2020, I had been off my meds for 6 months. My hallucinations were at an all-time high, and I had begun to enter the worst manic state I have ever had. I wasn't sleeping, I felt everything so strongly, and I obsessively painted a famous Stranger Things actor. But my tics reduced significantly. My brother suggested that I see his psychiatrist and I start medication again. In March of 2020, I saw a psychiatrist who immediately tried to put me back on medications that started my TD. I felt unheard and unseen yet again. Luckily, my brother was there to advocate for better treatment. Throughout 2020, my mental state wildly oscillated. Not only were the medications ineffective, but I also strongly feared my TD worsening. Since 2018, I have tried 12 antipsychotics and around 6 psychiatrists. Fast forward to now, with my current psychiatrist, I feel seen and heard. He put me on a low risk medication and pays attention to all of my symptoms and side effects. I am now clear in the head. I am now clear headed. I can see the permanent effects of those few years where I was ignored. I have foot twitches, rocking, and some puckering. Although I am lucky that my TD is mild, it could have been a lot worse. I do consider it good fortune since after moving in with my brother, I know I do consider it good fortune since after moving in with my brother, I noticed signs of TD in him very early on, and he was able to have his tics reversed. I look forward to using my experience to spread awareness and get people the help that they need. Thank you for listening to my story. Now, as we move on to final. Mm, I would like to say, as a peer facilitator, for NAMI Tallahassee, we have connection support groups every Tuesday and Wednesday available to those who struggle with mental health challenges. There's also an LGBT support group every third Thursday. Finally, for those of you who have struggled with mental Finally, for those who Finally, for those of you who have family that struggle with mental health challenges, there's family support groups second and third Tuesday. Finally, for those of you who have family that struggle with mental health challenges, there is a family support group the second and fourth Tuesday every month. You can sign up at www.namisupportgroups.org. If you have any questions about the groups, please email Jacqueline, our peer program coordinator.